Good evening, everyone. Thanks for tuning into my Facebook Live tonight. My name is Khanh Nguyen, and for those of you who don't know me, I am a community pharmacist. I've worked in the industry for just over 15 years, and some of you may recognise me from a talk that I delivered about 5 or 6 months ago when I spoke during World Glaucoma Week. I joined World Glaucoma Australia Pharmacy Committee about a year ago, and really enjoy working collaboratively with the community to deliver educational sessions such as these. So firstly, I'd like to begin by acknowledging the traditional custodians of the land on where I'm coming from today, the Turrbal Country, or Brisbane, Queensland, and I'd also like to pay my respects to elders past, present and emerging. So I'm currently working in the pharmacy educational space, but up until February of this year, I was working on the front line as a community pharmacist in a Melbourne 24-hour pharmacy. So I'm quite familiar with living and working in extended lockdown situations. Hello to anyone listening from the southern states. I hope you and your loved ones are remaining safe and well. And my heart does go out to all of you who are out there living and working in these conditions. So since the last time I spoke, I think you can agree that there's been a lot that's happened. It's a forever changing landscape, as you would have seen in the media. Today I've been invited to speak about the pharmacy services that you can access during lockdown. So this all came about because Glaucoma Australia had quite a few pharmacy-related questions directed at them, and I hope to answer some of them during my session tonight. So while I'm here, I thought I'd inform you about some of the new updates and services available in your pharmacy, and it will be an informal discussion, and I'll do my best to answer any of your questions afterwards as well. Because there is quite a bit of information to go through today, I'm going to refer to some slides, so just bear with me a minute so that it's a little bit easier for you to follow. Okay, so how can I access pharmacy services during lockdowns? So for those of you who are new to following Glaucoma Australia, we are an organisation which supports people with glaucoma get detected early and adhere to a management plan so they can prevent irreversible sight loss and maintain quality of life and live confidently with their eye health. Ensure you sign up to the email list or follow Facebook or Instagram for updates on anything new in this space. So what will I be discussing tonight? So as you can see, it's a busy slide, but basically I'll go through the COVID lockdown restrictions and how they affect your ability to go to the pharmacy for medications. What happens when your local pharmacy is closed due to being a close contact location? I'll go through some new pharmacy initiatives such as electronic prescriptions, which some of you may have used already, and Activescript List. I'll then go through an update about active ingredient prescribing. And then lastly, I'll go through COVID vaccinations in pharmacy. So how will COVID lockdown restrictions affect your ability to go to the pharmacy for medications? So for those of you already living in strict lockdown restrictions, you'd be very familiar with the 5 essential reasons for leaving home. So you can leave to purchase food and essential household goods. Secondly, to exercise within a close vicinity. 3, to care or for caregiving purposes. 4, to authorise, to work or perform education that you cannot do from home. And 5, to be COVID vaccinated in a nearby facility. So pharmacy fits into 2 of these categories. So firstly, we are an essential service for healthcare needs. And secondly, some pharmacies can also now provide you with a COVID vaccination. Pharmacies have remained open during these lockdown periods, and I can confirm even the 24-hour pharmacy where I worked recently in Melbourne remained open around the clock and could be accessed even after curfew restrictions for emergencies. Pharmacies are still receiving deliveries most days of the week, every day I believe, except for maybe the weekend. So there is no need to stockpile, and we are also only legally allowed to provide you with 1 month's supply of medication, just obviously to reduce any risk of any shortages in the community. If you happen to wake up with any COVID-related symptoms, you feel unwell, please get a COVID test and do not enter a pharmacy or any other facility. We can still serve you from your car or from home if you simply phone, but please do not enter a premises if you have symptoms. Because obviously you can potentially harm somebody else who's on the premises or put someone at risk, and it would also mean the pharmacy would need to close for a deep clean if, for instance, you were to be a positive case. If you need to collect prescriptions, such as eye drops, for instance, I would suggest utilising your local pharmacy's delivery services. Almost all pharmacies now have this service set up with either no charge or a small fee, depending on the distance involved and the time of the day that you are requesting the service. So some pharmacies may also choose to use a postal service, but beware that you need to allow for time to postal services to reach you. I know that Australia Post and some of the courier services are working really hard, and they're also working within restrictions, so just beware that there's going to be delays there as well. But rest assured, you will not be penalised for coming into the pharmacy to access a health-related service after hours. So what happens when your pharmacy is closed due to being a close contact location? So you may be aware that there's been maybe a handful of instances where pharmacies have been closed due to being a COVID contact location. Again, because we are an essential service, I want to reassure you that the deep clean process that occurs may mean that the pharmacy may close for a day, 2 days at the most, if it happened on the weekend. So obviously for the disinfecting process to occur. So for anyone who's interested, the deep clean process involves spraying a fine mist into the air, and it needs a minimum of 12 hours to settle before someone can enter the premises. And that's often why these businesses need to close. And pharmacy is a destination that would certainly be on the high priority list for a deep clean, to ensure that businesses can reopen promptly to provide healthcare to the community. If you tried to contact these sites, I imagine that there would be someone who could still provide you with some healthcare advice, provided that they have got phone diversions in place. So for your own peace of mind, I would suggest collecting your medication about 1 week before it runs out, so that you have plenty of time to replenish them or organise a new prescription if that's needed. There's plenty of reminder services that can be utilised. You can mark it on a calendar, use an app. Most pharmacies will have their own app to help you remind you to collect your prescriptions. So maybe just ask your pharmacist about what they use, or set up an alarm just to alert you as to when your next prescription is due to be collected. So if you happen to keep your prescription at a pharmacy that is closed for a deep clean, for instance, in the short term, I'd suggest attending another pharmacy for what they call an emergency supply of your medication. Bring the old packaging along so that the pharmacist there can provide you with the correct medicine and with obviously the accurate directions for you to use your medicines. If you're able to organise a new prescription for this pharmacy, this is obviously the preferred option. So ophthalmologists, GPs, and I believe optometrists are still offering telehealth and phone consults. And a lot of these health professionals are still operating using around the clock, or if anything by appointment, so you can still attend your appointments for prescriptions. And then they may either post your prescription or even send an electronic prescription, which takes me to my next topic. So electronic scripts. The concept has been around for a little while now. I know that we utilised it quite heavily last year in Melbourne in the extended lockdown. So what is an electronic prescription? So as you can see on the left-hand side of the screen, it's a digital version of a paper script. It's in the form of a QR code. So I think we're all pretty familiar with the QR code now, as it's used to check in to a lot of locations. Your doctor can send you the prescription as an SMS or an email. It's easily accessed. So if you take more than one prescription, each medicine will have its own QR code. So if you take, obviously if you have more than one more than one medication, it may mean that you may end up with multiple phone messages or emails. And a pharmacy that receives your digital script by SMS or email can often also organise for it to be delivered later on in the day, so long as you can send it to them within a timely manner. If the doctor has given you repeats, the pharmacy can pretty much send you back the repeats almost instantaneously in the form of a QR code, and this new code or token then becomes what you use for your next repeat prescription. So if you have multiple prescriptions, Activescript List has also just initiated in some pharmacies nationwide, and it would be the alternative to electronic scripts. It combines the prescriptions in one digital list, and think about it like an electronic file of your prescriptions that's stored in a cloud, which your pharmacy can then access and dispense from. It's a little bit difficult to get your head around at first, but the benefits of Activescript List is that you're then not reliant on your phone or to have data on your phone, and you then don't have to manage multiple QR codes. Now, if you're visual like me, it's worth logging on to the Australian Digital Health Agency website for videos to give you an idea of how electronic scripts and Activescript List both work. It's a user-friendly website and has a variety of electronic services explained in more depth. So some other changes that you may have also noticed. If you've had a consult with your doctor or specialist in the last few months and they've prescribed some medicines, you might have noticed that there's some differences in names prescribed. And this is because in February of this year, the healthcare sector shifted to a compulsory active ingredient prescribing legislation. So it means the brands you are now familiar with will now be referred to as their generic or drug names. But I want to reassure you that if you want to stick to the same brand, then obviously you can certainly do that. Just make sure you let your pharmacist know. And the shift was a requirement, which was to align Australian prescribing standards with the international standards. And it's also important to empower you as the patient to better understand the active ingredients in your medicines. But like I said, ask your pharmacist if you have any questions or queries. What they might do is actually refer to the generic name and use the brand name that you're familiar with, or they might even provide you with a list that has the active ingredient and also the corresponding brand that you're familiar with to refer to. Now, the last topic I'm going to speak to you about today is COVID vaccinations, and this is the latest service that pharmacies have been able to provide in some areas, in some states. It's a gradual rollout, so you'll find that most likely in your area there will be one around you that will be COVID vaccinating. And if you're unsure, you can go to the findaPharmacy.com.au website for a full list of pharmacies that are vaccinating COVID. You can book in by using their online booking platform or phoning in advance to ensure they can prepare your vaccination. And just also want to reinforce that the COVID vaccinating pharmacists have been required to complete the compulsory training just like other health professionals, to be able to administer this vaccine. And as you know, there are some strict storage and handling requirements for the vaccines. Okay, so that actually concludes my talk for tonight. So I can open it up now to any questions or if you want anything clarified about what I've spoken about tonight. So maybe I'll just have a look and see what has come through. Okay, so the first question is, what happens if my compounding pharmacy is closed for a deep clean? So for those of you who don't know, a compounding pharmacy is basically a pharmacy that specialises in producing something that is not available commercially. Pharmacists there are especially trained to actually produce these compounded items. So what I'd suggest is, if you can, refer to your prescribing doctor for a short-term solution. Hopefully you haven't let it run out to the extent where you've got no supply left, or you could try and contact another compounding pharmacy. But having said that, it's difficult to come across a compounding pharmacy. They're not, obviously because they're highly trained. There's even fewer sterile compounding pharmacies where they can produce things like eye drops. So I would probably just refer to your doctor in the short term. Okay, next question. So can pharmacies deliver my glaucoma eye drops to my house? Is there a click and collect? That's a good question. So I was just talking about how most pharmacies will have a delivery service. I know that there are some pharmacies, particularly some banner groups, that will have a click and collect service available. What you'd need to do is still be able to produce them with a prescription, a legal prescription, so that they can actually dispense it for you. And then obviously there would be some sort of arrangement for you to then for them to access the prescription from you, and I'm sure that they would be able to organise it in some circumstances. So it just depends which pharmacy around you actually has that service set up. Can my pharmacist help me download the Escript apps next time, or show me how to use my phone to access my scripts, because I'm not good at using my phone? Oh, absolutely. So I'm sure that your pharmacist would be more than happy to assist you with that. The other thing is, if your GP or your prescriber gives us consent, or you give consent for them to provide us directly with the prescription, they can actually email or send us the prescription directly, and then you wouldn't have to worry about it. I know that quite a few GPs I'd worked with in the past organise this for their patient. But absolutely, if you came in, your pharmacist, I'm sure every pharmacy now would be well and truly aware of how the electronic prescription process works, and they'd be able to assist you, no problem. Next question. Should I tell my pharmacist that I have glaucoma at the time of getting the COVID vaccine? Should I get my eye pressure checked after to make sure the vaccine hasn't increased my eye pressure? That's a really good question. So yes, so basically when you go to the pharmacy, they'll ask you to complete a questionnaire. It's a form that actually will ask you whether you have, you have allergies, you take other medications, whether you have other medical conditions, and this would certainly be where you would alert them. And I think because it's also a fairly new thing, the vaccination, it's always good to gather as much information as possible in order to find out later on whether the vaccination, can affect certain conditions. They're still undergoing a lot of research now, so it's difficult to say, but certainly I would be letting the pharmacist know. And it's a good idea, I think so, to get your eye pressure checked beforehand. If you happen to be on some new medication at the time as well, perhaps what you could do is delay starting the new medication at the same time as your vaccination, just so that you can distinguish which one is contributing to a higher or lower eye pressure. Okay, so sometimes when you're starting new medications or getting vaccinations, it's difficult to, I guess, know which one is causing which. So it's probably always a good idea to separate them so that it's easier to distinguish. Do all doctors use e-scripts? Okay, so not all doctors or pharmacies may use Escript at the moment. And the reason is because there's a lot of extra work that gets involved in setting up e-prescriptions for the doctor and the pharmacist. So basically a lot of it would have to get done in their own time, and obviously we know that all health professionals can be really busy with their appointments and patients, so I would think that there will be a gradual rollout to ensure that things are done obviously legally, professionally, and that all the staff that work at the clinic are trained on how to use electronic scripts. Okay, so somebody would like to know, Judy, interested to know more about Activescript List. Okay, Activescript List is basically designed for anyone who is on multiple prescriptions. So personally, I think if you're on, say, 3 or more medicines, it would probably be easier for you to use Activescript List. The Activescript List itself would be set up by your pharmacy. So I'd suggest, going to a nominated pharmacy. But the idea is, if you were to be away, any pharmacy that actually has Activescript List should be able to dispense your prescription. So it's, like I said, it's an electronic, list of all your prescriptions, and it's stored in a cloud. And basically what you do is, I guess when you went to the pharmacy, you provide your name, some maybe your Medicare number, a date of birth, something that identifies you. And then if you provided the consent, they would then dispense either one prescription or multiple prescriptions from your list and supply the medications to you. And then obviously if the doctor had provided repeats, it will work the same way. The repeats will sit in your Activescript List, and when you run out, the doctor will then prescribe you a new Activescript List. But like I said, maybe go to the Australian Digital Health Agency website. They've got some really good videos for both electronic scripts and Activescript List. So it's a visual way of looking at how it works, because you can't actually see an Activescript List. It's in a virtual cloud, so it's a little bit hard to get your head around. Okay, so if I have a paper prescription, can this be emailed to my pharmacist? So if you have a paper prescription, you can email the copy to your pharmacist, but at some stage the pharmacist would, depending on what state you are in, the pharmacist would need the hard copy. So I'm assuming that this is a traditional paper prescription that you're talking about. So I think that what you would be best to do is you can email the prescription, but your pharmacist at some stage would have to organise for it to be collected, or maybe you could post it, or if it's safe, you could just drop it in next time you're there. But legally, the pharmacy needs to receive the original prescription so that they can, obviously supply you with the medicines. Okay, I think we've come to the end of the questions. Thank you, everyone, for your time. I hope everyone remains safe and well. If there's anything that you want to if you have any questions later on, please direct them at Glaucoma Australia, and they can get in touch with me, and I'm happy to answer anything after this live as well. So thank you, and I hope you all have a great night.